From the JAMA Network, this is JAMA Author Interviews. Conversations with authors exploring the latest clinical research, reviews, and opinion featured in JAMA.
Hello, and welcome to this JAMA Author Interview. I'm Dr. Ann Cappola, Professor of Medicine in the Division of Endocrinology, Diabetes, and Metabolism at the University of Pennsylvania, Director of the Penn Medical Communication Research Institute, and Associate Editor at JAMA. My guests today are Drs. Joe Cappella and Rick Street. Joe is the Gerald R. Miller Professor Emeritus at the Annenberg School for Communication at the University of Pennsylvania. Welcome, Joe.
Hello, Ann. Happy to be here.
Thanks so much. And Rick is Professor in the Department of Communication and Journalism at Texas A&M University and Professor of Medicine at Baylor College of Medicine. Welcome, Rick.
Thank you, Ann. I'm happy to be here as well.
They are here to talk about delivering effective messages in the clinician-patient encounter, a contribution to JAMA's new Communicating Medicine series. Thank you both for joining me on the podcast today. I will start with Joe. Joe, why do we need research on medical communication? Isn't that just part of being a clinician?
Well, of course, it's just part of being a clinician, and there's truth to that. But one of the important issues that we want to make clear to the audience is that effective communication in the clinician-patient context is not just window dressing. It actually is a medical outcome in many respects when it goes awry. And there's an ample amount of research to make that case. And as a consequence, you want to make sure that the communication process, if it's going to have medical consequences, which it can in terms of people's uptake of treatment recommendations and so on, and effective or accurate communication within that environment, if the outcomes are physical ones, medical ones, and not just window dressing, leading people to feel good, then I think we want to make sure that what we're doing in that context is as effective as we can be and as efficient as we can be. So that's the place to start.
Yeah, thanks so much. I like your point about it being efficient as well as effective, because the concern is that we just need to spend more time with our patients, which would be great, but we are often quite restricted that way. So really what we want to do is to be effective and efficient, and that's really the goal. So Rick, now what do you think about why we need research on medical communication?
Well, there's a couple of points that I'd like to make. One is there's a good bit of body of work that focuses on pathways through which communication can contribute to better health outcomes. And, it's not always, hey, you talk a certain way and you have a better outcome, but it's the way the communication can accomplish things that deal with having the patient be satisfied with the care that they're receiving, having them understand what's going on, being more committed to a treatment plan. And that in turn fosters adherence to a treatment regimen, and that in turn can contribute to better health outcomes. So there's a lot of evidence that indicates that effective communication can have at least indirect effects to health outcomes. But the other thing is, from a clinician's point of view, if most people consider themselves good communicators because they don't have much problem communicating. But as a clinician, sometimes you'll get that difficult patient. They're either resistant, they may be hostile, contentious, or disagreeing. And we realize in those settings that there's a problem with communication here that I'm having with this patient. So understanding the research behind which we can be able to work through those differences to create some shared understanding is a really important thing to do. But then on the other hand, you have these other situations from a communication point of view that are often more insidious. And that is sometimes when you're talking to a patient and they're sitting there looking at you, they're not terribly engaged, they're nodding their heads, and you think as a clinician, yeah, the patient's understanding, they're picking up what I'm talking about, everything seems to be good. The patient themselves may not be understanding at all, but they've used that as a way of being rather quiet and silent because they're being more resistant or not understanding what the clinician is doing, so they have their polite, head nods and things like that. I mentioned those two examples just to show the interesting complexities with which communication matters, both in terms of the obvious with the difficult patient, as well with the ones that are more subtle that we may not be aware of with a very passive, less activated patient who we assume is doing what we would want them to do, but in fact, they may not be.
Great, thanks. So Rick, now I'm going to take it back to the piece that is being published. And what do you see as the take-home message from your JAMA contribution?
Well, I think the most important thing to understand about effective information exchange is it's more than just presenting the facts. The information exchange is done within the context of the clinician-patient relationship, and you need to have someone you're talking to, the patient, be receptive to what you're saying, because you got to understand that they need to see you as a trusted source of that information. And so what you would want to do is make sure you have a relational context during those encounters, and when what you're saying is perceived by the patient as being honest and in good faith and in the patient's best interest, so that they are more receptive to it. So it has elements of the quality of the clinician-patient relationship in there as well. But then when you look at the actual information exchange that's going on, it's certainly need to present your information in a way that the patient can best appreciate it and use it in terms of what they're thinking. Is you need to understand how they think about the situation that we're dealing with here. That deals with the part that we talk about, uncover what the patient's beliefs are. And then, of course, you need to then present information in a way that's understandable and accurate, and then followed up by the promotion of what it is to enhance its credibility, and then check for understanding. And I go through those steps in the article, just listening to those like that, to realize that there is a series of steps that you go through, communication strategies you go through to move from understanding where the patient's coming from so that you can then provide information in a way that they understand so that both of you can get on the same page.
Yes, one of the topics that we do discuss in the article that I think is crucial to an effective clinician-patient interaction is the notion of checking that the understanding that you think is present is in fact present, by asking them to, for example, tell back to you the understanding that they do have about what you've talked about already. And every good communication system has a kind of checking process, a kind of quality control. And that's exactly what you're doing when you're checking people's understanding. And you want to do this in a way that invites the possibility that people are open in their communication back to you. And it's done in a face-to-face way so that you can get those nonverbal cues that are present that help to indicate the way in which the communication is successful.
Great, thank you.
Yeah, I would just make some comment about the distinction between the art and science of communication, like clinician-patient communication. The science associated with that is some of the things that we've talked about. These are strategies that people can use that have potentially certain effects to get the patient to disclose more, to be more honest, to be more receptive, things that you can do to help patients understand. You know, the part of that science, I think, is what clinicians have in their communication toolbox that they can use if needed. The art of communication in clinician-patient interactions is how you use that to work through the nuances of individual situations. You know, and a lot of the skill that comes in not only in what you've learned that are best practices, but also the experience that you get. So these are things that I think that are best looked at as things in the toolbox that tend to work a lot of the time, and that they are to be used as they needed to address certain situations. And that is as a resource that can be very helpful.
Great, thank you. I'm now going to move on to giving you each examples of patients who may show up to the office where clinicians could use some guidance. I've tried to select some topics that are common situations that arise clinically. And for the purposes of these examples, let's assume that the patients are not locked into a particular point of view. And the first one that I'm going to start with is MMR vaccination. So Joe and I are both in Philadelphia where we've had a measles outbreak. And I wanted to present the scenario where we know that measles vaccination works very well. In fact, none of the people, as far as I'm aware, in this outbreak who have gotten measles were vaccinated. It was all amongst those who were unvaccinated. And let's say you have a parent who presents in the office of a child who has not received the MMR vaccine. What would you suggest that we do in terms of approaching that particular parent in that situation?
So, the first item of business, it would seem to me, is to make sure that you have some appreciation of what motivations and concerns the parent has in this context, assuming that they're willing to share that information with you so that you're not starting from a place of assuming what is the greatest concern for them. You'd like to know whether they have misinformation. So I would start by querying the patient to determine where they're coming from so that you can begin to assess, what kind of response to provide. once you start there, then you have at least a place for an initial kind of response to the patient in terms of providing, alternative informational sources and factual information. Again, not necessarily in an argumentative way or by way of trying to create a point of disagreement, but by providing information, because in the end, of course, it's still the patient's decision as to whether to have the vaccination or not. And other techniques that you can, pursue is, of course, the use of a narrative story about regret that other patients might have had for failing to get the MMR vaccination for their children, and then the child comes down with an illness and perhaps is sick for an extended period of time.
Now, vaccination is one of those issues where there are some people that are just deeply entrenched in their view about this. Is there anything that we can do when someone is really saying, there's no way that I will get this vaccination or have my child vaccinated? Is there anything to do, or at that point, if they're that deeply entrenched in their point of view, is there anything we can or should do?
Well, there's quite a continuum between a person being open to hearing what a doctor has to say to being completely, totally resistant to it. I assume at some point in time, if I may use an ICU analogy here, there's a point in time in the ICU where no matter what the doctor has done, they've done everything they possibly could, and it's just not going to work out for the patient. And at some point, you just have to say, I did all that I can. And then the thing is, you could probably look at this the same way with that person that you're talking about there, who is so totally resistant. There's only so much you can do in order to, before it's just, I'm not going to convince them, they're not going to change their mind. But before that time, there are certain things you can at least try to think about doing, like try to talk about validating the patient's perspective. Like, I can see kind of, what you're thinking there in terms of how you're thinking about that. But, these other things you might consider, and whether that be a story with one of your other patients that you can talk about, or whether it would be something where you talk about a person's sense of wanting their best interest in mind for their family, whatever kinds of things you might bring up to try to edge them over a little bit more to being more receptive. And so there is a point that it doesn't matter anymore, but there's a lot you can do before you can get to that particular point.
So thank you so much for those insights about what to do with the patient and the MMR vaccination. I'm Dr. Ann Cappola, and I have been speaking with Drs. Joe Cappella and Rick Street about their manuscript, Delivering Effective Messages in the Clinician-Patient Encounter. You can find a link to the article in this episode's description. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com or search for JAMA Network wherever you get your podcasts. This episode was produced by Daniel Morrow at the JAMA Network. Thanks for listening.